Hello, my name is Carlos Arellano. I'm the physician assistant student working on behalf of Dr. A today. Would you allow me to conduct the physical examination and interview today?
Yes.
Okay, thank you, I appreciate it. Let me just wash my hands before we begin. What's your date of birth?
My date of birth is July 15, 1993.
Okay, and what's your full name?
Viviana Monares.
Okay, and how may I address you today?
Miss Monares.
Okay, Ms. Monares, can you tell me the reason why you're here today?
I'm here because I have some pain in my right arm. Leg.
Your right leg?
Yes, leg.
Okay. Besides your right leg pain, is there anything else that is bothering you today?
No.
Okay, then let's talk about your right leg pain. Can you tell me more about it?
It started last night. It hurts here.
All right. Okay, and you mentioned that you started last night, and since then, has it been like constant goals, or like has been just getting worse?
It's been getting worse.
It's been getting worse.
Mhm.
Okay. And have you had any previous episodes like of these pains before?
No.
Okay. And can you point me again with one of your fingers the exact area that it hurts?
Here.
Okay. And besides that area, is there anything else? Have you noticed that besides that area, is there any area around that pain has moved?
No.
Okay. You mentioned that you started all night. In the previous days, was there any trauma to that area? Like, for example, you hit yourself doing something?
No.
Anything that you remember? Okay. Have you traveled recently?
Yes.
Okay. Can you tell me more about your travel?
Yesterday we drove back from Arizona nonstop.
Okay. All right. And all right. And is there any seat contacts at home?
No.
Okay. Can you describe me your pain?
It feels sharp.
It feels sharp. Okay. And a scale from 1 to 10, 1 being the least painful to 10 being the most painful you can ever imagine. How would you describe your pain? How would you rate it? 8? Okay. Sorry to hear about that. We're going to spell my process in a second so we can get you feel better. All right.
Thank you.
All right. Have you noticed anything that makes it worse?
When I walk, it hurts more. Yeah.
Okay. And anything that makes it better that you tried so far?
Well, I try to put a pillow under whenever I lay down, but it doesn't really help.
Okay. Besides trying the pillow, was there anything else that you tried, like medications, for example?
No.
Okay. And also, I'm gonna ask you: have you noticed any numbness on the right leg?
No.
Any tingling sensation?
No.
Any swelling that you noticed?
Swelling, yes.
And the swelling, did it start at the same time as the pain, or
Yes.
develop?
Yes.
You started the same?
Yeah, around the same time.
Okay. And have you noticed any color changes on your leg, like redness or pale?
Yes. Yes, redness.
Redness? All right.
Yes.
And also the redness, did it start with the pain, or?
It started with the pain, and it increases as it hurts.
Okay. All right. I know that your vitals right now, fever. You have no fever, but do you have any fever episode before getting into
No.
the ER? Okay. All right. So I'm just gonna do a quick summary to whatever we just discussed right now, and you let me know if it was accurate or there's something that I'm missing. Let me know and I'll add it on. Anything that you think that is incorrect, please correct me. All right.
Okay, thank you.
Okay. So you're coming today for right leg pain, and you mentioned that it started last night. And something I forgot to ask you about last night. What were you doing?
Nothing. I was getting ready for bed.
You was getting ready? Okay. And you mentioned that since it started, it's been constant, but also been getting worse. You remember you have no previous episodes from this pain, and you mentioned that this is the area that hurts the most, and
Yes.
there's no radiation, no movement of the pain at all. You mentioned that there was no trauma related to it, and you have no sea contacts, but you did travel. You were driving back from Arizona last night nonstop. Yesterday. And you described the pain as sharp, and pain scale from 1 to 10, you mentioned that it's an 8. And what makes it worse is just walking, and what makes it better, you mentioned you tried to put a pillow under, but it didn't work out. Okay, and you mentioned that there's no other treatments you tried, like medications, right?
Right.
Okay, and you mentioned no numbness, no tingling, but there was swelling, and there was redness, and no fever. All right. Okay, so now we're gonna move into the past medical history. This is just to see if anything from the past might be affecting you today. All right.
Okay.
Any previous illnesses?
No.
Are you taking any current medications?
I'm taking birth control.
Okay. And for how long have you been taking birth control?
8 years.
8 years. And do you know by any chance the dose that you're taking?
I just take 1 pill a day.
1 pill a day?
Yeah.
All right. Have you been on blood thinners before?
No.
Okay. Any allergies to medications?
No.
Any seasonal allergies? Or
No.
like allergies to food?
Mm-mm.
Okay. All right. And any hospitalizations?
No.
Any previous surgeries?
No.
Any previous trauma?
No.
What about, are you current with your immunizations?
Yes.
All right. And your yearly exams?
Yes.
All right. Okay. Have you been pregnant before?
No.
Okay. What was your last menstrual period?
It was on March 22nd.
March 22nd. All right. Okay. So that's it for past medical history. Now we're gonna go into family history. When I talk about family, I want you to think about your parents and any siblings that you may have. Okay.
Okay.
This is just to see if there's any disease running into the family that might be affecting you today. All right. Is there any history of chronic illness in your family?
No.
All right. Okay. That's it for family history. Now we're gonna go into social history. Before we begin, just to let you know, these questions are very personal, but at the same time are very private, and this information is just gonna stay between you and me. This is just to get to know more about your lifestyle and see how might that be affecting your health today. This is a question that I do to all of my patients, and it's just basically, like I said, just to get to know more about you, your background. Just to let you know before we begin, if at any point you feel uncomfortable, just let me know and I'll skip through the questions. You're not forced to answer any of those questions, okay?
Okay.
Is this okay if we begin?
Yes.
Okay. Can you tell me more, a little bit, describe me your diet?
Diet, I eat salads, veggies, grilled chicken.
Okay. And what about exercise?
No exercise.
Okay. Have you smoked? Are you currently smoking?
No.
Have you smoked in the past?
No.
Do you currently drink alcohol?
No.
Have you drink alcohol in the past?
No.
Do you currently use any illicit drugs?
No.
Have you used any illicit drugs in the past?
No.
Okay. All right, and we're almost done with the history. We're just gonna do a review of systems. This is just a quick review of some symptoms that I want to see if you have felt it before, and so we can probably think about more of it, or if we need to make sure that we're not skipping anything, basically. Okay. So when I ask you about these symptoms, I want you to think about from the last 2 weeks to the last 2 months if you have ever felt them. All right. Have you noticed any night sweats?
No.
Any loss of appetite?
No.
Any weight loss? Any cough?
No.
Any wheezing?
No.
Any difficulty breathing?
No.
Any chest pain?
No.
Have you ever felt that your heart is beating too fast?
No.
Any poor circulation that you notice on your legs?
No.
Okay. Any unexplained bruising?
No.
Any excessive itching?
No.
Have you noticed any stiffness like on your knees and your ankles lately?
No.
Okay. Any decrease on the motion that you do, like when you move them?
No.
All right. Okay, that concludes our history. Now we're gonna go into the physical examination. All right. Okay. I'm gonna start by listening to your heart and just breathe normally for me. Okay. Now I'm gonna start with your lungs. Let me just go through the back really quick. I'm gonna lift up a little bit your shirt. So now I'm gonna ask you to go ahead and take a deep breath in and out for me. Okay. So now every time you feel that I'm putting my hands on your back, go ahead and say 99 out loud. Okay?
Okay. 99, 99, 99.
Okay. I'm gonna do the same thing on the back. When you feel my hands, I'll go ahead and say 99. Okay?
99, 99.
Go ahead and lift up your chair all the way to the top, all the way to here. Go ahead and say
99, 99.
Okay. Now I'm gonna percuss. Okay, go ahead and lift it up all the way up to here for me, please. Okay. Okay, now I'm gonna do the same thing in the bathroom, right?
Okay.
I'm just gonna move it really quick. Okay. Now I'm gonna listen to your heart, right? I mean to your lungs. So every time you feel putting my stethoscope on your back, go ahead and take a deep breath in and out through your mouth, alright?
Okay.
Okay. Now I'm gonna do the same thing on the front. I'm just gonna keep listening to your lungs, alright?
Okay.
Okay, go ahead and lift up your chair all the way to here. And I'll repeat again. Okay, you can put it back. Okay, so now we're gonna check your legs. Let me just take a look at both of them, please. Any pain while I'm doing this?
Yes.
Any pain in this one?
No.
Just take a quick look at it. Any pain here?
Yes.
Okay. Alright. Okay. Now I'm gonna ask you to lay in your back for me, please. This way.
Yes.
Yeah. Okay, so I'm just gonna take your capillary real quick. Alright. Now I'm gonna ask you to go ahead and bend both your knees for me, please. Okay, I'm gonna check for your pulses, alright? just gonna go ahead and check. Lastly, for your sensation. Okay. Now go ahead and put your legs normally. You feel it, sir?
Yeah, sure.
So are you able to feel the side that I touched, right? Okay, go ahead and let me help you to go ahead and sit down again. Okay, so can you tell me my findings, please?
Right leg is swollen, no cuts or insects. Leg is very warm. All pulses are normal. Capillary refill normal. The right calf is red. Normal sharp sensation on both legs. Positive Holman's signs and normal lungs and heart examination.
Okay, so based on physical examination and history, I'm gonna go ahead and diagnose you with deep vein thrombosis. Basically, what deep vein thrombosis is when a clot forms in one of the deep veins of your leg. In your case, it was on the calf area, and basically, what I think can be the cause of it is the use of birth control, and also the travel that you mentioned, that you were basically driving all the way up to here nonstop. So basically, the prolonged standing can cause this disease. So let's say you go home and you find a family member that want to ask you, well, how you got that? I mean, what is it that you have? Your diagnosis? How would you describe it in your own words?
That it can be a clot caused by birth control and sitting down from the drive from Arizona to Texas.
Okay, and basically, just to confirm your diagnosis, I'm gonna order also an ultrasound of your leg. Basically, it's just to see what's inside of your leg and to confirm that there's a clot on your right calf, right? And also, I'm gonna order some blood work. I'm gonna order a D-dimer. Basically, it's a substance that is on our blood when this disease is present. Okay. Can you describe that in your own words to me?
That I'm getting an ultrasound just to confirm the blood clot, and I'm getting blood work, a D-dimer.
All right. Okay. And also, I'm gonna give you some medications. They're blood thinners, and basically what they do, they're gonna start destroying your clot and also prevent from another clot to form. So we're gonna do this for 6 months. We're gonna start it right here, and then we might do some changes in those 6 months, but I'll explain you more once I give you the prescription. And also, my recommendations is that you, for now, stop the birth control.
Okay.
Because if you continue using, it might happen to you again. So it's very important that you do an OBGYN schedule a visit so they can see other methods of contraception. Okay. Can you describe that in your own words?
That I need to set up an appointment with my doctor and to suspend the birth control, and then I'm gonna be taking blood thinners for 6 months.
Okay. Yeah. And one last thing, make sure to avoid any sexual intercourse, because by stopping the birth control, you might get pregnant.
Okay.
So if that's not on your wishes, on your plans right now, I'll recommend you to stop any sexual activity until you see your OBGYN, alright?
Okay.
Okay, can you repeat that in your own words just to make sure it was accurate?
No sexual intercourse right now to prevent pregnancy.
Alright, okay. Is there any questions before I leave the room?
No, that would be all.
Okay, well, I hope you feel better and I'll get back with the medication, alright?
Thank you.